All right, guys, we're episode 14, all about men today. So I'm really excited about this episode. I think it is really trending right now in a lot of different avenues as far as surgery, aesthetics, functional medicine. With us is Dr. Donaldson. So he's our resident plastic surgeon, and we're going to talk all surgery with him. We have Dr. Weston, partner in crime. She's our double board certified doctor in sports medicine, family medicine, and she's our director of functional medicine. And then for the first time, round of applause, we have a patient on the podcast. So we have Jarrad Tracey with us, and he is going to talk all about his experience and what he's kind of gone through on the surgery side of things. So I think we're going to get started with you because we don't want to keep you on here for the whole thing. So we're going to eventually bring another guest on, but kind of let's start with your journey. Like, I know you mentioned that it's something that had kind of been going on for a while. And so kind of talk through like what that experience was like and all the years you kind of dealt with it and leading up to actually making the call to like come in and see us about it.
It actually started in school. As a kid, a lot of the kids are chubby, running around. And I can actually remember, and God rest his soul, my dad had the same problem. Mm-hmm. So I guess I inherited it. You'd know more than that about me if it's actually inheritable. But as a kid, why I got the chubby gene, I don't know. But I can remember, I can't really tell you what we did yesterday, but I can remember some of the things the kids called you and how they treated you and how you didn't want to take your shirt off in the locker room. And, shirts versus skins in basketball. You never wanted to be skins. You always wanted to be shirts. And it did. It always plagued you, swimming with the T-shirt on, not wanting to do X, Y, and Z. And, maybe that's where I got the thing of, not even wanting to swim a whole lot, even in my adult years. So it did. It kind of led up to that. And then as we were speaking earlier, through high school, my weight kind of fluctuated. And then I got real heavy, even after I got on the volunteer fire department before I got a full-time job. And I knew I had to lose some weight. But it always seemed to affect me, whether I was skinnier, heavier, no matter what it was, it always affected me and my self-esteem. And that was the biggest thing, was the self-esteem. They always tell everybody not to be vain, but at the end of the day, everyone wants to look good when they walk around, right? Mm-hmm. Everyone wants to look good when they take their shirt off. Everyone can lose a few pounds still. But at the end of the day, I had always wanted to do something, but I was never in the position to do it. Because as we all know, a lot of times insurance doesn't pay for it. So you're coming out of pocket. And we were just never at that place in our life prior to when we did it that we could actually pay for it. Even when I lost a lot of weight when I decided I wanted to be a full-time fireman and I had to get past all the tests and everything. Even when I went from like 240 to 165 in 6 months.
Oh my gosh.
Yeah, exactly. I looked bad. I didn't think I looked bad,
Wow.
but apparently everybody says I looked bad.
But then you looked real good.
But even with that, I still had the problem.
Yeah.
So you keep saying the problem and the what?
I mean, gynecomastia, man boobs, the things the kids called me, walking around with, and I still wear compression shirts now only because I wear a lot of my T-shirts untucked. Mm-hmm. That's the only reason I wear them. I used to wear them to try and hide it. I mean, even years ago, I can remember buying shirts 3 times too small and trying to fit myself into them to mask the problem. Always wore 2 T-shirts. Mm-hmm. No matter what, to try and mask the problem. But you couldn't. Mm-hmm. You just couldn't. So that is the problem that we wanted to, and I guess to me it was the problem, mm-hmm. And that's what we wanted to get past. But as I was saying, when I lost the weight, I still had it.
Yeah.
So I think that's when it dawned on me, no matter what, no matter how many ads you see, get rid of this, get rid of that, do push-ups, eat this, eat that I was never going to lose it, no matter what I did. Yep. Until we had an opportunity to do something like this with you guys.
I think that's how you know the difference between gynecomastia and just like weight.
Yeah.
So weight, I mean, in general, if you're a higher weight, sometimes you can have more weight up top, yes. Just based on like a little bit of genetics, but just hormones and mm-hmm. where you deposit weight. But if you lose the weight and you don't lose that, I feel like that's a really good indicator of gynecomastia, which is a problem that you can't out diet.
No.
You can't out exercise.
No.
It's just, it is what it is.
Yeah, and I mean, gynecomastia is true male breast tissue. All men have breast tissue. And in adolescence, as you described, half of guys have gynecomastia, which is sort of more breast tissue than what we would hope is normal. Half of those guys then outgrow it. So you're talking about a quarter of the entire adult male population who actually has this condition. And then it's just a matter of how much is there and how much it bothers you. So, fortunately, the techniques are such that we can do it in a minimally invasive way in some cases. In some cases, it's more invasive, which you might talk about. But it's something that, as you said, if you lose weight, oftentimes that makes it worse because it takes that fatty tissue can almost conceal the actual breast tissue, so that when that goes away, you see more puffiness. And I have guys who work out like machines, building their pec muscles, and again, cut their body fat, and that tissue is even more prominent because it sits on the muscle and makes the nipple puffy. And so, we have ways to reduce that, kind of no matter what the situation is.
I did not realize it was a quarter.
Yeah.
That's
It's
lot.
a ton. We see so many patients.
Yeah, I didn't realize.
You bring up such a good point, though, when you're talking about you don't remember yesterday, but you remember that. So many things just make such a long,
It's trauma.
lifetime,
It is trauma as a kid.
long impression that happens in your childhood. And I remember when you said that, I literally remember the guys who wouldn't want to be skins. Like I remember those guys who would never want to be skins. They always want to be shirts.
Yep.
And it's like, oh my gosh, but you don't think about it then. That said, like from doctors' perspectives, if there is somebody listening whose child is experiencing that, is there anything from a functional medicine side that can be done to help alleviate that or prevent it? Is there anything, like what is the youngest you would treat somebody that's dealing with that,
Yeah,
from that
we
perspective?
look for someone, well, first of all, I always prefer an elective cosmetic surgical situation to wait till someone's 18 to be able to make that decision for themselves. But there are certain situations in which if a child is really being bullied for something like this, and they can demonstrate that they've been to their pediatrician, that they've been that they've had the hormones checked, that they've looked into other causes, because there are a lot of causes for medical treatment or medical gynecomastia diagnosis, and so you have to look down the list, what medications this person's on and what genetic potential they have, and if they have a diagnosis, an endocrine disorder that could be causing it. But if you rule out those things and you just get down to the fact that there's more tissue there than what there should be, and that tissue's been there for at least a year, and sometimes in some cases 2 years. So, I would go as young as, certainly have to be a teenager, but 14, 15 years of age, if they've had this for a couple of years and they're getting teased and are not able to enjoy the quality of life that they should be able to otherwise.
What is the recurrence rate?
It's gone. So we remove the gland.
Okay.
And so the gland doesn't grow back.
Okay.
And so there's controversy as to whether or not you leave a small sliver of gland behind the nipple so that you don't see indentation of the nipple. And we usually do leave a tiny sliver to be able to prevent that deformity. But once it's gone, it's gone. And so it's a hormone-sensitive organ, just like female breasts.
Yeah.
And so over the course of time, once someone achieves 70, 80 years of age, the hormonal milieu may be such that grows a little bit. But if the vast majority of the gland is gone, it shouldn't come back.
Okay.
I'll be honest with you, it's been life-changing. It has. I mean, and you remembered this story, but I mean, I didn't even want to swim with the kids. Heck with that. You can go swim, you can take your shirt off. And I still don't swim a whole lot, but I don't mind taking my shirt off. That's the biggest thing. I walk around town. I don't think I focus, even my wife will tell me that I focus more on the problems I see more than what the general public sees. I think we all do that.
1,000,000%.
But I can guarantee you, I can pick it out on somebody. And maybe it's because I had it. But as soon as I see a guy walking through, I can pick it out like that. It's just the truth.
Just hands him a balancing cart.
But to me, if I could pick it out, why wouldn't you pick it out with me walking through the store?
Yeah.
Right? Is that the right way to think of things? Probably not, but it was always in the back of your mind. And just the confidence that it brings. We went back and forth multiple times. I knew I wanted to have something done, but A, where do you have it done? B, can I afford it? And C, do I really want to go in and have surgery? You know, the only surgery I'd ever had was, you know, I am a cancer survivor. I think we talked about that. So I had a port placed and taken out. That's the most invasive, knock on wood, surgery I've ever had until this. And I was a little worried. I mean, well, and then the background. You being a medic and a fire, I'm like, oh crap, if I don't wake up from this, where do we go? You know, but would I do it again? 100%. And I think you guys told me that. Every guy that's ever done it said they should have done it before, and I should have done it before if I could have. 100%. I mean,
Yeah.
it's been life-changing. And I picked you out of a whim. I did. I just started Googling reviews. It wasn't someone telling me, hey, I've had this, go here. It was strictly reviews and who I felt comfortable with.
And that's why I love that you're on here, because I think not a lot of men will talk about it, but if a quarter of people who have it will then like continue to develop it. I mean, if people talk about it.
Yeah. And that's the thing, you know, like we talked earlier, you know, like I don't run around town saying, oh my God, I had this surgery with a sign on my truck. But at the end of the day, like when we were talking about when we were in Phoenix, one of the other guys out there, and I would have never known it. He's like, dude, I had that surgery. I'm like, really? Never would have known it. He had it way before me, so the scars were almost gone. Plus, he was real tan, so they kind of blended in. I was white as a ghost. But he said the same thing. And I don't know. He lives up around Cleveland somewhere, so that's how I knew that. But he said the same thing. He's like, you know, it was life-changing. It just, once you do it, it changes so much in your life. And you feel kind of bad saying, well, I had to have plastic surgery. No, let me tell you something. If I could afford it to pay for 5 guys to do it, I would. Because I know what it did for my mindset and my, you know, and even like I said with the kids, that was the biggest thing. Was I was always embarrassed. I'm like, you guys go do what you want. I'll hang out right here. And it just...
Yeah, life's too short for that.
100%.
Yeah.
And you don't want to, like, with your kids, you're like, you're perfect just the way you are.
Yeah. Yeah.
And then with ourselves, we're like, well, there are some tweaks I would do.
Every guy's different, though, too, in terms of the amount that's there and then what technique is required. And so gynecomastia is graded on a scale of 1 to 3, 1 being the most mild, 3 being the most severe. So 1 could be simply just kind of puffy nipples, right? And that it requires a really minimally invasive technique. 2, it's a little more involved. 3 is kind of the most extensive, and I think that we had you at a 3, and so I think
did. And we had that conversation of, like we talked, you know, do you want to have the full surgery? Do you want to have, I guess, the less invasive, but you're always going to have that skin hanging?
Right.
To me, that's a Band-Aid.
Yeah.
To me, that was going to be a Band-Aid because I still wasn't going to walk around my shirt off. So why not, A, spend the extra money, the extra recovery time? You know, to me, it was like the drains and stuff. That's what I wasn't gonna grasp of how are we gonna do all this. But I got blessed. I got a nurse at the house, and she took care of everything. But yeah, it hurt. Of course, it hurt. But I don't think I ever took a pain pill other than Tylenol. And the recovery wasn't that bad. The biggest thing was I wanted to go do stuff before you told me I could go do stuff.
Right. Yeah.
You know, because I was feeling better. But we did exactly as you said to make sure I could go back to work, to make sure I could do X, Y, and Z at the time.
That's good. Yeah, I had a patient at one point who was sort of on the line, didn't know what to do, and was in a similar situation as you, and opted to do the less invasive treatment in that case. And actually came back 6 months later and said, you know, the skin bothers me. And so we converted that to
I knew I wouldn't be happy.
to a more full operation.
I knew I would not be happy if we went that route.
But then there are guys who are kind of lucky who have those puffy nipples and were able to just make a little incision. In some cases, even in the office under local anesthesia. And that is like removing a mole. You know, I mean, that's pretty about as non-invasive as you can get. It just depends what you got.
Right.
You know? So.
Do you feel like, I know a lot of patients will say this, and I'm wondering if you feel this way, but they'll say, like, I knew, like, physically it would change my life, but I didn't know, like, emotionally and psychologically how much it would, just on a day-to-day basis, how much, like you were mentioning, like, it just literally bothered you so much that you didn't even realize it until after you fixed it, and you just, like, it's something you don't have to worry about anymore.
I did not realize it would be this well. It's just made it so much easier.
Yeah.
I don't even know how to explain it. It's just made daily life easier. In a sense that, like I said, we're going back to the vainness. But just, it's hard if someone, and hopefully a guy does watch this, but if you've never had it, you don't understand it.
Yeah.
But when you do have it, it holds you back from so many different things, or you wonder, because I'd tried multiple diets, working out X, Y, and Z, and then when I lost all the weight, I'm like, well, crap, that didn't work. I mean, I lost this, but not that. And I think that's when the light bulb clicked that, other than surgery, we're here. Yeah. This is where it's at. But then also looking back, talking to my dad, as I got older, my dad would tell me about him getting picked on in school. Okay. So the same thing that happened to him happened to me, and hopefully none of my boys have it at the end of the day. But it has. It's made it's nice to be able to go pick shirts and wear the shirts and be like, cool, here we go. Or in the summertime, be like, hey, and I always go back to the swimming, but that was one of the biggest things.
Yeah, I remember you said
that. That was one of the biggest things. Yeah. And I was embarrassed. Like, even walking around my own house, we have 14 acres. I'm afraid someone's going to pull in the driveway, But now I could care less.
Oh, I love that.
So, yeah, I mean, it makes every day easier.
When you're saying you were kind of doing your research online, and I will say this because I've met with thousands of patients at this point, and the one thing I will say unanimously about the male patients that come in for gynecomastia, every one of them did an organic search and found us online because no one talks about it. And that's why I was so excited about the podcast, because it needs to be talked about. Like, why is it taboo for you to do it, but not for us to do it?
Right.
And if it's something that bothers you, like, we're in the confidence business. We're not in the vanity business, I don't think. I like to say we're in the confidence business. And, you have every right, if it's something that bothers you on a daily basis, that's prohibiting you from being the best dad you can be, the best husband you can be, the best everything, then fix it. If there's, you have the means to fix it, we have a guy who can over here, do it. It's so worth it. But when you were kind of doing your organic kind of research and things like that, what was, what ultimately made you go with this guy over here to my right? Like, what was it that kind of just gave you the confidence to, move forward finally?
Yeah, well, let's take a step back, because you're exactly right. Nobody does talk about it.
I know.
And when you Google it, all you find are, when you hit images, you see images, and you're like, going, okay, that kind of looks like me, but that doesn't. Because I tried grading it myself. I'm not going to lie. All right, so how bad are we going to be?
Dr. Google. Yep.
100%. And I hate it when you show up on a run. They're like, I Googled my symptoms. But at the end of the day, it wasn't so much I went to Dr. Donaldson for gynecomastia. It was just, I read reviews of guys, women, everything. I just wanted someone that I could figure, hopefully, that I could trust, that's going to go in there, because I'm going to be on anesthesia. And I think you Foley tubed me. I mean, when you get to that aspect, I don't want to just head down south of the border and let somebody take a scalpel to me.
These are the different questions that a paramedic
Yeah.
will think about. It's like, am I going to be fully tubed?
It is, but it
Those
is.
are important things.
But that's where I was at, was I wanted to make sure that these reviews, I mean, not even just two of them be like, this guy butchered me.
Yeah.
And there wasn't anything even close to that. And I don't even remember the other places, because there might have been one or two other places that I may have called. I don't remember now, but I remember once we called your office and we did the initial consult and stuff, it just felt right.
Yeah.
And that's how it had to be. And Brandy and I talked with her being a nurse. It just had to feel right with everybody. And the staff, how you guys welcomed us in. And then when we met with you, I mean, if I would have felt anything was off, I would have been out.
Yeah.
I just would have been. But nothing ever felt that way. And the reviews on Google they spoke for themselves. They really did.
It's great to hear, and I'm thrilled that was your experience. And I think it's important, I always look at it as a two-way street as well. We're lucky to have a lot of patients. And so we interview our patients too. And it's meaningful when you come in and there's a connection and you have realistic expectations. Sure. And frankly, that you'd already done some work. You've tried to work out, you've tried to lose weight. You're kind of at wit's end, and at that point, we know, we know, that this is kind of what we need to do. And so everything's kind of out on the table at that point, and there's a mutual trust in that case, and so it all worked out well. So we're thrilled to have you as a patient, and obviously thrilled that you've had so much success in your results.
I would hope that, and like I said, I mean, I'd even looked at taking loans out prior to that, prior to being able to just being blessed enough to pay for it. And if I knew someone that said, I don't know if I should or not, I'd be like, dude, you probably spend that much on Starbucks every month or every year.
Yeah.
Take
That's so
the loan
true.
out, do whatever you need to do because it's, and like you said, I'm 46 now. I wish I would have done it when I was 36 or
Yeah.
30 or
How many years ago was it? That you did yours?
just about what, 2?
2 or
it's
3, I
been-
think.
Yeah,
Okay.
give or take.
Okay.
Yeah. So, I mean, it
And
was
I-
it was kind of towards the winter, I think it was. I think
Gotcha.
it was February, is I think 2 years.
Okay.
Okay.
And if it is 3, it's gone too fast.
Well, to that point, I mean, I have patients of all ages, right? And almost all of them wish they'd done it sooner.
Yes.
And they just aren't at a point in life where they can. I mean, I've helped patients in their, 60s, maybe early 70s who recall very similar stories when they were teenagers and have lived with that for 50 years
Yeah.
until they could have the resources and the time to be able to commit to doing something about it. And they're like, you know what? I still want to do this.
Yeah.
And kind of put that in the past, even later in life. So I think it's a real gift, for someone who's younger, whose parents can afford to help them, or whatever the case may
100%.
be.
Yeah.
I've helped kids in college who can have their whole lives to look forward to.
Yep.
In that situation, that's a real gift.
It's, when you go back and you think about it, I mean, it's not a lot of the mental that a lot of kids go through these days at all. But when I use the word trauma, it truly is because I can remember and, who cares? Tits, tubby,
Yeah.
pepperoni nipple. I mean, I can remember all that, like it was yesterday. And it's just, it's that stuff that sticks with you, know. But in the same sense, it's that stuff that you don't want your kids to ever go through.
Yeah,
100%.
1,000,000%. And from the financial standpoint, like you mentioned, I don't think that should ever inhibit anyone from coming in and at least talking to Dr. Donaldson about it. That's where I come into play, and I can be real creative when it comes to making it affordable. And there's little tricks and tips and things you can do that can make it work for you. And it's just, it's worth every penny. Like it's
Oh my
such
God,
an
it's some of
investment
the
in
best money
yourself.
I've ever
I know
spent.
it's an investment in yourself. It's an investment in your confidence and an investment for the rest of your life. Like it's done.
Sure.
You get to enjoy it forever. Like it's better than a car. I mean,
Yeah.
let's face it. So I think it's just wrapping your head around that and like putting yourself first is hard for people and making yourself a priority and like doing something good for you. I think a lot of people struggle in general with that.
Sure.
But it really is, you just need to do it or at least explore it,
Yeah.
come in and have a conversation about it for sure.
I
So
would 100% agree.
through the surgical part of the journey, what was unexpected? Like what was you kind of mentioned recovery, like, yeah, it was uncomfortable. I know you had drains. Everyone freaks out about the drains. Let's talk about that.
Yes.
Talk about that. They're not terrible. But kind of talk about kind of that journey and was there anything unexpected that you weren't expecting or?
I think I remember coming out of anesthesia, I got real sick. So, it just didn't match with me right. And then I think I was upset because my wife wouldn't let me drive home. The pain was pretty bad the first couple of days. It just was, but I didn't want to be on any pain meds only because of the back. You just hear stories, and I didn't want to go down that route. But it wasn't unbearable. I remember you guys telling me the drains are going to be more of a pain than anything, and that's what they were. They were a pain. They were clipped to me, and they went everywhere with me, and that was probably the biggest thing. But then just not being able to lift my arms and do X, Y, and Z because I'm always on the go. I'm always doing something. There's always something to be done around the house. That was the hardest part. And that's one of the reasons we chose a colder month to do it because there wasn't as much stuff and I could kind of hibernate and do,
Smart.
Things like that. The recovery wasn't that bad. It wasn't what I expected. I expected to be down for weeks and blah, blah, blah. But you guys made it easy. It was you do X, Y, and Z, and you're going to be back out on your own at this time. You don't do X, Y, and Z, and we're going to have C, and we're going to revert some stuff. But funny story, we were talking about kart racing, and I think it was you. We were talking about go-karts, and they're like, oh, yeah, you can get back in that thing. And my wife's like, wait a second. Because we had a race coming up like in March. And I
This
think
is
we
all
showed
coming
them
back
the
to me now.
picture. Yes. And she's like, you are not allowed in that. You know, picturing like little Magic
yeah,
Mountain.
yeah.
I'm probably the
go-karts.
wrong person to talk to because I'm always like,
Yeah.
oh, you're great. You'll be fine.
Yeah,
I'm like
I'm
back
like-
at work the next day.
No.
Internally, I'm
Please.
like, yes. And my wife's like, nah, put the brakes on. But those were the biggest thing is just getting back to 100% normal.
Yeah.
But the recovery, the drains, I had my wife to help me to empty them and take the measurements and all that stuff. But it wasn't bad. And then, we ended up coming back in one more time to just do little local stuff on the sides, which that wasn't bad at all either.
And again, it's important for our listeners and viewers. You had the most severe case.
Yes.
You're grade 3, and so it was more extensive tissue. It was skin. And so, and you probably represent in that population probably 10 to 20% of our patients. 80 to 90 are in the milder end, in which case no drains. Not the extent.
Oh, that would have been a cake.
Yeah.
mix.
I know.
Incisions. Right. So I'm saying this is kind of worst case scenario.
Yeah.
Is kind of what you went through, and still was tolerable.
It was 100% tolerable.
Yeah.
But like I said, we followed the directions to the T.
Yep.
Yeah.
You follow the directions and you don't hurt anything where you have to go back in and do extra work.
Sure.
And it puts us off
Yeah.
longer.
Yeah.
Well, just for like reference for people listening, like grade 3, when you're removing the skin, is what we refer to as like extended gynecomastia.
Right. Yeah.
Yeah, and then with you were talking about the less invasive, which is just the incision, like a crescent at the base of the areola, essentially.
Right.
Patients who have that, like one of the things I'll tell them is you need to listen to recovery instructions because you're going to feel amazing and you're going to want to way overdo it because you feel great, but that doesn't mean your body's not recovering. And so it's just one of those like balances with men that they never want to like sit still and listen because I feel fine, I'm going to do it. So it's, you did the right thing by kind of following the rules.
Yeah, for the most part, we
Yeah.
have a pretty healthy young population who wants to get back to their normal lives, and we do everything we possibly can to allow that to happen as quickly as possible. But still, you have to protect your investment on the front end and not overdo it.
And the other good thing too, though, was there was never a lack of communication. It was always, hey, how you doing? Or if you need anything, call us. And that's a big part there too, that you can call the office or I could call you, or I'm sure if I even wanted to, I could have had your phone number, at the end of the day. But with that, that's where, like when we were talking about like the Google reviews with the office staff, it speaks for itself. It just does and goes a long way knowing that that's there and it's not just, hey, we're going to do this surgery, give us your money, you're on your own.
Yeah. Are there, asking you, Dr. Donaldson, as far as like any adverse side effects to getting this done? Is there any negative aspect of getting gynecomastia surgery?
It's really just kind of the common complications that are possible through any type of operation, right? So we worry about bleeding, we worry about infection. Those risks are probably less than 5%. We worry about the way the scars heal, and so with a grade 3, the scars are more extensive than they would be in a grade 1 or grade 2. But otherwise, we think about the inversion of the nipples potentially, or a little bit of rippling or dimpling of the skin where that volume used to be. There's a little variability as how the skin kind of settles back down towards the muscle afterwards. And so we try to hedge our bet and use techniques that allow that to settle as smoothly as possible, but there's still some variability to that. But otherwise, there really aren't, there's the potential risks of anesthesia, obviously, but it's not an extensive list of really dreaded sort of side effects or complications otherwise.
And that said, like we see a ton of men each week to talk about this and have these procedures done. And I mean, it's very rare that I feel like we have a, what did you call like an indentation or something like,
I think it's
or
probably,
something that you have to
probably
tweak.
close to 1 in 25, 1 in 30 will have a little bit of
common.
inversion of the nipple, something like that. But it's by far and away the most common procedure we do for men. It's liposuction and gynecomastia.
I love that. Did you do anything special like for your scars? I know like a lot of men come in and with the extended, they kind of run along like the chest wall, essentially. I don't know like the correct term, but that's close enough, I guess. And a lot of them will be like, well, I'm going to get a tattoo over this. I don't really care. Or you have chest hair, so it blends in. Or did you do anything special to kind
I don't.
of like...
All my tattoos are down my arms.
Okay.
But, talk about the scars. I mean, I mean, to me, I've got big scars.
Yeah.
Do they look bad? No. But you can tell I've been cut open.
Yeah.
But I don't care.
Yeah.
That's the thing. The scars don't bother me one bit. if anything, it's a conversation piece. Like we talk,
A lung transfer where they think they had like surgery on your lungs or
yeah,
something.
yeah. But no, honestly, I'd never even thought about doing
Yeah.
a tattoo there. Like I just got another one here, and my wife she's like, "You're about done." So, but no, I mean, I think that's awesome. If someone wants to do that, lady I know is a breast cancer survivor. She had breast removed, tattoos everywhere. So kind of the same thing. But to me, I could care less if you see the scars. They don't need to blend in. They don't. They may not be as healed as they should have been because every once in a while I'd forget to do what I was told to do, and then my wife would yell at me, be like, "You're supposed to be massaging them." And, but they're part of me now,
Yeah.
and they just the difference, and that's what we talked about. The difference of the scars compared to where we went from the beginning,
Yeah.
night and day.
I love it.
Night and day.
That's great to hear. I mean, it seems as if about half of my male patients care about what the scars are going to look like, and half of them don't so
Yeah.
much. So it's great to know that hasn't been a big factor
No,
for you.
not at all. Not, and I think when we had the initial conversation too, was coming out of it, I knew I was going to have scars. Wasn't sure how big they were going to be, but I had an idea of where you were going to cut.
Yeah.
And at the end of the day, if you look at where we started to where we are now versus the middle option of the skin, the scars are 100% the better option.
Yeah.
100%.
Your results really, really good. Yeah, for sure.
And how often do I walk around with my shirt off compared to just my shirt on? Because like right now, if I would never have this tight of a shirt on. I would have never worn this. It would have been loose, baggy, hoping to God. I remember as a kid, even actually as an adult, taking my shirt and stretching it over my knees and trying to stretch things out so it was less approachable.
And then picking it away from your body
All the time.
Yeah.
And even after we had it, I found myself always doing this, walking around. I don't really anymore, but you always did that to try and pull it away.
Yeah.
Did you play sports? Like,
I played football.
yeah, okay.
Yeah. So that was kind of concealed in
Yeah.
the
Yeah.
day, but
Yeah.
it's funny,
Oh, yeah. Well, you mentioned being able to walk through a place and kind of tell
Yes.
who has it. And that's kind of one of the signs. Baggy clothes,
Yeah.
double shirts, picking it away from your body. And we see that in the consultations.
Sure.
It's kind of a telltale.
Yeah, double shirts were a staple until the compression shirts came out. Like I said, now I just wear them just because I don't tuck my shirts in, and I don't like not having something. But before that, it was find the tightest one you could get.
I love it.
Yeah.
For the guys that the scars do bother them, which is awesome, it doesn't for you. Like, there's so many modalities that can help with that too, including like scar camouflaging, which we have at our office now, and lasers and things like that. So there are options if guys are really afraid of those. We can help lessen the appearance for sure, which is nice.
Yeah, I know you guys gave me the scar cream, and I think that helped as we put it on it. But I think there was even a, "Do you want more?" I'm like, "No, we're good." I don't know how to explain it. It was just, it's fine.
Yeah.
At the end of the day.
It's a very fair trade-off compared to what, you had. Do you have anything else you want to add or anything about?
No, it's just great to see you again after a couple
Yeah.
of years. I don't often get the chance to see a
know.
patient after a couple of years have gone by, and you look great, and it's fun to have you on the show and just get a chance to catch up. So
No, we appreciate it. And like when you called, that's why, there was no questions asked. Because at the end of the day, if there's something in your life that you can do and then help somebody else, if this even helps one guy be like, maybe I should,
Yeah.
then why not? Because I know how it's made me feel, and I'm sure however many thousands of guys you've done, it will help them in the long run.
Yeah. One thing I didn't mention too is just, maybe you didn't, I apologize if you did, but just the vast range of men we see, like all ages, and then all, like, we've done professional athletes, we've done professional bodybuilders, we've done, mom or not moms, we've done dads, just every realm, every age.
Yeah.
So nobody is not a candidate. If it's something that bothers you, it's worth looking into.
yeah,
Oh, yeah.
absolutely.
Yeah.
Done
No,
great.
I appreciate the opportunity.
Yeah. Is there anything you want to add before you head out, and we can give you your evening back to you and your wife?
like
Tell
I
her
said-
thank you for.
Oh yeah. No,
Tell her hello.
Like I said, if somebody is watching it, just do it.
Yeah.
Honestly, I'll never forget you saying, and you saying, everyone that has done it said they should have done it well before. And that's the honest to God's truth.
Biggest regret.
Honest to God's truth.
Yep.
That's the biggest regret we hear.
In our whole office, 1,000,000%.
Yeah.
Because I thought about it multiple times, but I'm like, I'm not taking a loan out to do that. No, I probably should have. I just paid it off.
Absolutely. I 100% agree. So, well,
awesome.
thank you so much.
Thanks,
I really
Jarrad.
appreciate it.
Yeah.
So, Jarrad's amazing. Loved him. I don't know. That made me so happy to hear his whole story. And we didn't want to keep him. So we're going to kind of move on to some more surgery, though, because gynecomastia isn't the only surgery men do.
Yeah.
So let's talk about, I'm not going to say what I think, but why don't you give your opinion on, what you think are popular surgeries that you do for men in our office?
Yeah, I mean, for the last decade, I think men have been outpacing women in terms of increasing the amount of plastic surgery that they do. And I think it starts with patients' wives and girlfriends, significant others who've had work done, and they say, well, why does it need to be them? Maybe I can benefit from this too. And so the most popular procedures have become, certainly gynecomastia is number one in what we do, but liposuction as well. Male patients do abdominoplasties or tummy tuck. And there's facial procedures as well. And so we see rhinoplasty and liposuction of the chin and neck. Obviously taking advantage of lasers and skincare and Botox and things of that as well. So it's a big trend, and men are getting lots of benefit, same as the women.
It's so funny because I feel like there's been a trend just recently in the last, I think, 3 months that so many husbands are coming in with their wives for the consults. And that happens. It's happened all along. But I feel like there's been such a trend recently of that. And I think that's their excuse to dip their toe in without saying they want to kind of see what the whole world's about. And how many times when they're sitting there, the guys are like, well, what about this? Can you do this for me?
Yeah.
Hey, can you do a 2-for-1? I hear that all the time.
I get, my wife sent me.
Yeah.
Yeah.
But then I look at their paperwork, they're single.
Yeah.
That's
well,
hilarious.
usually their wives or their significant others are a little more brave to begin with, and so they say, "Let's see how this goes."
Yeah.
And then you'll end up, taking care of a patient, and 6 months later, the gentleman will come to our office and say, "Hey, let's talk about this."
We've done a lot of husbands and wives.
Yeah.
As far as other surgeries too, there's been a big trend in our office on face and neck lifts for men as well, which has been really cool to see, and the results have been incredible.
I think as the techniques get better, and
Yeah.
I don't perform facial surgery, but my partner, Dr. Seifert, does, and she's incredibly talented. And
I agree.
the techniques have just come so far. So there's less downtime, there's less pain, there's less swelling. The things we can do post-operatively to help with those things, even pre-operatively to make the journey a little easier has been great. And the results are better than they've ever been. So it just
agree.
makes more sense than it may have 20 years ago.
Yep. And the incisions are incredible. You can't even see them. It's insane. And I know a lot of men, excuse me, I don't, the wine, what are you going to do? I think a lot of men too are very focused facially on jawlines. You always hear that. Guys will be like, oh, he's got a jawline. That's a masculine jawline. So I know some things that can help with that surgically are submental liposuction, maybe a chin augmentation.
Yeah.
I don't know if I'm missing anything, but aesthetically too, we can do some things which Stacey can touch on. Is there anything surgically that other than those, maybe a couple things that
Those
can
would
help
be
with
the big
that?
things that help with the contour, and there are different techniques for that as well. So we do neck lifts that we really hide the incisions behind the ear and behind the hairline. We can also do direct neck lifts where an excision, men have more facial hair and can conceal lines that are directly on the neck itself. So direct neck lift, just excising that tissue that's right in the front and leaving a scar, which heals well and just takes care of the problem in the most straightforward manner possible. Rhinoplasty sometimes will change the contour, the perceived contour, especially from the side, the profile view, can go hand in hand with jaw surgery. But they can be of huge benefit and less downtime and less pain than people think.
Some of the really cool aspects too are submental liposuction can be done typically in our office under local anesthesia. So you can technically drive yourself to and from if you want. Minimal downtime for the most part as far as not being under general anesthesia, which is awesome. Another thing we can do in our office for men is like a blepharoplasty, which I didn't even mention, which is kind of nice, and men do take advantage of that too.
Yeah, it's usually genetic, and it's just a little heaviness to the skin of the upper eyelids, and a little pinch in the office with an incision that lies right in that natural crease. Suture goes in and comes out 5 days later, and it's minimal bruising, minimal downtime. And I think that's probably one of the biggest bangs for the buck in terms of facial surgery, just because it's the easiest to recover from.
I was literally just going to say that. Yeah. I think it's easy, like as far as a procedure goes. It's under local, recovery is easy, and low risk, and it makes such a difference. You just look more awake and vibrant, and people don't know what you did, but it really, I agree, like the biggest bang for your buck in the office, hands down, surgically speaking, I think. I think for men and women, but I love that. Jawline wise, because I kind of touched on this. So aesthetics. So I love that men are getting more into like the aesthetic side with filler, Botox, lasers, like more kind of preventative aging or whatnot. What can you do on your end to like facially, like as far as like gaining facial balance or, really defining the jawline on your end of things?
Yeah, so we can use fillers, we can use biostimulators. We have things like PDGF and regenerative medicine. That's now like a new buzzword. So we can do all sorts of things to help with that. But really it starts with the skin first, right? So we always focus on skin health with men
and they're terrible about that.
How many men wash their face?
No, none.
Like I have to put...
and they don't age, which makes me angry.
Well, and
they age later is what
true. Well, we'll get into that.
Later.
That pisses me off too, but we'll get into that later.
But like, let's talk about that because I feel like, and I'm part of this, wave. Like, I think my husband looks more attractive as he ages.
Yes.
And
they look more distinguished and we look like old hags. Yeah. Like, I hate that. Now, somebody mentioned it's because they shave their skin. Like, they shave their face for a good majority of their life. So they're exfoliating it constantly.
Not all men.
Not all men. But up to a certain point.
Like you age later. Like we age between 45 and 55. You guys age between 65 and 75.
Which is bullshit,
dude.
Big difference. But I would still say my husband's
I actually don't mind that.
So you technically haven't even aged yet. You're not even 65.
Oh, that's funny.
Yeah.
Bullshit.
But like if you look at just natural aging of the face, they just age later.
I will say though, I had never had a facial before hiring an esthetician into our practice, and now once a month.
Yep, you are very good at it.
Tatiana or Nikki or Andy.
He never misses.
Once a month, I see the books.
He never misses it.
Yeah,
well, it's scheduled every month.
I don't pay for it, so that's probably why you don't see it in the books.
That's not why I'm saying that.
But
I'm saying you're a little more frequent than once a month.
Okay. But they put me on a skincare regimen, which I follow religiously.
You do.
And it makes a difference.
You do.
Yeah, it does.
And you never miss your facials.
I don't miss my facials.
I love it.
I try not to. But it's just pleasant. It just feels good. I actually fall asleep every single time.
Yeah.
And they just do what they do, and I'm good for another month.
Yeah.
And I use my routine in the meantime.
It's so good.
And I didn't think I wanted to mix that stuff into my routine, because my routine used to just basically be Dove soap and,
exactly.
and run my hand through my hair. But I add whatever she tells me to add, and it's not that hard. I smear it on.
Great.
I would love to see. I'd love to see her.
He's not going to be face forward on our campaign.
I'm dying.
Skin
care.
I love it.
Just smear it.
But anyone who has not had a facial at our office has got to come have a facial at our office.
I know.
The Luxe facial, well, any of them. The organic facial. There's a million different versions, but they're incredible.
Yeah.
Like we have literally wizards behind the facial game, working their magic. Agree. You just walk out of there and you look like disheveled, like you slept for 100 years and just like woke up.
Coming out of a cave.
Yeah. And the worst is when you schedule it early and then you have to work.
Yeah.
You know,
I always do it at the end of the day.
I'm like, why don't I do it at the end of the daggone day? I'll do it
Otherwise,
like when I can fit it in.
Looks like I've come out of a nap. I have.
1,000,000%.
Yeah.
I'll do it in the middle of the day or where I can squeeze it in. I'm like, really? I have to go work right now? Like, all I want to do is just like sleep.
Yeah.
So amazing.
I just find men tend to be more discreet, right? Yeah. So a lot of our patients are already discreet about what they do, which I can appreciate. But men, definitely. They're like, my wife sent me here. She hates my forehead lines. Like, I want to be in and I want to be out.
Yeah.
Like, my credit card's on file. Let's go.
Yeah,
And
they're
I-
very direct and like,
for, and I appreciate that.
Yeah.
So
No BS, not a lot of questions.
nope.
Just get it done.
Take this
Move
away.
on. Yeah.
I find that men, I'm going to say this, don't really mean it, but are the easiest to please.
100%.
But right?
They just
Yeah.
tell you what they want. You give it to them. And they're
Yeah,
happy
like
on
it's
their way.
direct.
yeah, it's very
communication.
Super
direct.
direct.
You're not trying to figure things
No,
out. Yeah.
like and in fact, I can attest to this functional medicine wise because your visits with men, your virtual visits, they're like, yep, I can do this. Let's do this. Let's do this.
They'll
right?
also tell me
there's
like,
this-
I'm not going to do that. I'm not going to do that. And I'm like, great, let's find something else for you.
Yeah.
To do. Like, I just appreciate the honesty.
yeah.
And they
Yeah.
just want to
They're
know
not
what's going to
pleasers.
work and
They're
what's
not
not.
pleasers. Yeah.
The surgical consultations tend to go that way too.
Yeah.
You know, and like we just learned from Jarrad, I mean, it's bothered them for a long time. They have the means to do something about it. They come in, it's the decision's generally almost made before they
Yep.
come.
1,000,000%.
It just checks the box and take care of it.
It is easy. That is for sure.
I think it's probably a little bit less of an emotional decision compared to women. As far as plastic surgery.
I don't know.
I feel like
I feel
women
like-
for plastic surgery.
Tell us
Well, I
what-
feel
tell
like
us what you mean,
women
Dr.
women
Weston.
Well, I feel
really
like
go
for
through the guilt
women,
trip.
It's like a
guilt trip.
multiple
Yeah.
year process. So I have a good friend who's having surgery next week.
I know who that is. Yeah.
She's so excited. She came
Yeah.
up to me. We were working out. What day is today? We were working out this morning, and she was like, "It's 1 week," and I'm like, "Oh my gosh, that's amazing."
I'll have
And
to text her.
Literally, she texted me as I was leaving at like 6 a.m. and she's like, "Do you have any high protein meals I can make for my family before I have surgery?" And I'm pretty sure Jarrad, lovely man, I'm pretty sure he wasn't like prepping meals for
Yeah,
his
to be like incapacitated for a couple
No,
weeks.
so
Yeah.
for women,
Laundry.
like, it's
Yeah.
kind of a
That's a
it.
real commitment.
It's a real
and
commitment.
I think that you have the guilt factor as a mom
guilt.
too, where you're
You're
like,
like-
I can't do this for myself.
100%.
Oh, it's like the
where
money
guys
guilt
just
factor,
don't. Yeah.
and then also like, what do you tell your kids?
Yeah.
Da, 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 da. So it's just different. So I feel like for men, they want to know, can you fix the problem? Are you any good at it?
How much does it cost?
How much does it cost?
and
then
how
I'm
much
done.
time? When can I work out
Are you
again?
I
a
think-
tool? Are you a tool?
Which I think is, but I think
No, are you
that's
good at
important.
it? That's
But
what
I
are
think
you good at
that's
it?
Kind of I think that's what differentiates us
Yeah.
because you're pretty normal. I mean, that's what when I
Wow,
talk to
that
people.
might be the nicest thing you've ever said.
Actually,
Wow.
is.
I actually think it is
That's
the
like-
nicest thing she's
That's
ever
really
said.
high praise.
We have it
Cheers,
on video.
guys. Cheers.
We have it
That
on
was the
video.
nicest thing you've
Thank
ever
you so
said.
much. I feel like giving you a
Yay.
hug.
You guys are
Aw,
doing
do we?
Really
Do you guys
kind.
need a moment?
Wow.
No,
We can
listen
give you
to
one.
me though. I've worked with a lot of
Yeah.
surgeons,
Yeah.
and like you get a lot of ego. You just get a lot, like a lot
I
of
feel like
personality.
there's a
but
lot
you're
of weirdness
very-
with surgeons. Like
you're
they have
very
zero
normal.
personality.
And I do think you meet people where they are, and I think you you speak to patients in a way they can understand, and that's hard to find.
Yeah.
Yeah.
You are like you're
And
a normal guy that they would want to go out and have a
a
beer with.
1,000,000%.
Yeah.
In fact, your friend's calling you right now.
Oh yeah.
And he's ready to go out. And have
He's
a beer.
probably out here. That is an
Have him
important thing,
join
but
us.
when I'm talking to patients
Yeah.
or even like people I randomly meet on the
Yeah.
street, or I mean, I just talk about it all the time. And like my friends' husbands, I'm like, you just have to meet him.
Yeah.
Like you just have to actually meet him for the consult, and then once you meet him, you're for sure gonna do it.
Well, and
Yeah.
'Cause it's-
what
'cause
I
you're
love
you.
the most about you too is again, well, we have 2 surgeons and you, and you're all like so great and like normal to talk to, and there's no barriers or you're just very normal people, and easy to relate to, which I felt like I never would relate to a surgeon. I was always intimidated because I'm not in medicine. I'm just this common folk. So that is what I always loved. But I always loved that you are honest with patients to a fault, where you will like say no, and I think you just don't see that a lot, where it's like, you know what, like, yeah, I can give you lipo all day long, but I'm not going to risk your life doing a surgery that you're going to look worse when I'm
Right.
finished. And I just love that you're honest, and you're just, and people love that too.
Well, thank you
Yeah.
both for the
Yeah.
compliments.
Yeah.
I think that's a huge filter that we use when we hire people, is that we are authentic people who aren't different with their friends or at home than they necessarily are at work. We're not playing doctor. We are who we are, and we're going to speak frankly about the situation. And like I said earlier with Jarrad, like it's a two-way street. So fortunately we get to choose our patients as much as they get to choose us. And I think that, it has to be a mutual exchange, and there has to be some common ground in order to, we go through a fairly, traumatic, intimate experience together. And things usually go right, but when they don't, there needs to be a level of trust that we're going to be on board and get things fixed. And so it's an important relationship.
Well, everyone's so vulnerable when they come in, and I think you and Dr. Seifert, and you too. I mean, they aren't naked when they're talking to you, which adds a whole nother level of vulnerability.
Yeah, but they're talking about like
1,000,000%. Yeah, like about intimacy or libido or like ED or whatever. But they're not like naked while they're doing it. So I think there's just this like trust factor in you both make everyone feel so very comfortable, and everyone will come in and I'll always say, "How was your consult?" And like, "Oh my gosh, it took me forever to get the nerve to come in here, and they were just so great. I just felt so comfortable. I just feel so much better about everything." And I think that you guys just really have a gift, you and Dr. Seifert, to make people feel that way. So good job. Well done. Well done. Back to aesthetics, because I don't want to dance around it. I'm hoping men will listen to this podcast, and you're like, we have, what were you saying? Regenerative and biostimulators and Botox. Like, let's dumb it down for the dudes. Like, what is that? What does it do? What can you help? Like, if they're talking about their face and they're like, so let's just face it. Like, I've been there. Like, dudes are getting divorced and they want to date 30-year-old girls and they're in their 50s and 60s.
Well, I don't know.
What can those dudes do? What can those dudes do to get a 30-year-old girl
More than 15 minutes in a row.
divorced?
No, that's not my game.
I mean, that's the reality of it. Let's just face it, everybody. So, like, no, what could you do? Like, if they're like, I feel old. So if I don't want to get surgery, what do you have in your toolbox? Like, I get like the Botox filler, PDGF, but like, what can you help
So
them?
here's the thing. It's
complaints.
never just it's never just one of those things. Right? So I feel old is like a menu of services. It starts with skincare. It starts with sunscreen, and nobody wants to hear that. But that's science. That's the truth. We can do fillers. We can do Botox. We can do the facials. All of those things matter. And when they all come together, it's a beautiful mix of services that help people feel better.
What will Botox do for the guys out there?
Explain wrinkles, what it does. Obviously. So if you don't move a muscle, the muscle doesn't make a crease in your skin. If you don't make a crease in your skin, you don't get a wrinkle.
And then the filler will help where?
Volumizing. So we can help define certain areas, chin, jawline for men. And so those can make you feel more masculine. They can help define some of those features that you want defined, and that's helpful. But really, like sagging skin or sun damage, those things are lasers, skincare, Morpheus 8 for tightening of the skin. It's a whole menu of services. It seems overwhelming, but we can really, really dumb it down, honestly, for your own individual goals.
I feel like men can like if I were to pick 3 things, it would be Botox, filler, laser. Obviously, skincare, sunscreen, that's just a no-brainer. Like, I'm not even going to talk about that. That's just standard. But like Botox, preventative.
I'd rather see a man on skincare and SPF than Botox.
Yeah.
I'd rather see my husband getting lasers than any Botox. Like, I like his wrinkles.
Same.
So, I don't hate
them. I don't hate them either.
I like these wrinkles. Like,
I'll say though, like filler for a guy,
never do it, but
like the one thing I love about filler is this instant gratification. Like, you get it, you see the result instantly. I can see guys for like facial balance that really suffer from like maybe a weak jawline or maybe chin like needs a little more projection.
For sure.
Or something like that, or whatever. Under eye, I know under eyes are tricky, but like I think filler can tastefully done for a man
100%.
because you can totally overdo it. Can help give them more confidence. It's all like we talk about confidence. It's all about confidence. And if it's something that when they look in the mirror, they're like, I feel this, then I feel like, those are things that can help.
I think too, like it's a misnomer to say that guys don't want all their wrinkles gone. I think if you look at your father and your grandfather and have these deep, deep, deep creases, you're preventing that from an earlier stage. So you can have lines of animation and just not have that Abraham Lincoln etched in, I just went through the Civil War kind of look. You know? But I also think men complain of being tired, you know, and so skincare and just looking brighter and more fresh. And I think, you know, some of the volume in the lower eyes can
What
be
about
nice.
your laser experience, Dr. D?
Yeah, I just
because
had-
I actually had 2 patients come to me after that
Yeah,
post.
yeah. I mean, I just had little irregular bumps on the surface of the skin, and so just zapping those
They are
selectively. Yeah, it's gone. So it's
Yeah,
smooth.
it's great.
Problem solved.
Looks
but
gorgeous.
during my facials, they almost looked like little pimples. But the only way to take care of them were to shave them off or to laser them off. So thanks for doing that. And I think guys are
He
worried
didn't
about.
complain a minute about it.
No,
Not guys, he was my
amazing.
favorite patient.
it's incredible. You were my favorite provider.
I'm dying.
I'm sure.
Just
Well-
kidding to Adrian and Nikki and Andy and
The rest of the office.
Yeah,
Everybody
everybody else.
We all know you're
Paige
the
and Claire and
skank of
everybody else.
So
But I also think hair restoration.
I was just getting ready to
Yeah.
say that. In
So,
hair reduction
yeah.
for men.
Right.
Hair restoration, hair reduction. So back hair reduction. Are any men
Did you
getting
see-
manzillions or no? Is that not a thing?
No, I
Okay.
mean, to each
Just
their
laser
own.
that.
Okay, I love
Yeah.
it.
If it bothers you and it's dark hair, we
Go
can
for
take
it.
care of it. If it's gray, if it's salt and pepper, because, you know, my husband, he started getting the weird old man patches.
Yeah,
But, like, they're starting to get salt and pepper. So I was like,
you got to do it when it's dark.
yeah.
Oh, it
Yeah.
won't work when it's salt.
No, it's got to be dark.
Oh, I didn't know that.
Yeah, so we got to find the melanin
It doesn't-
pigment in the hair follicle.
So, say you have a friend.
Asking for a friend?
Yeah. I mean, Jared's the least hairy person ever, so it's not my husband, but it's a friend's husband.
Okay.
So
For real,
say-
asking for a friend.
Literally asking for a
Okay.
friend. So say she has to take care of her husband's back often.
Okay.
Uh-huh.
With a,
If it's dark, we can do it.
Razor. If it's dark, yes.
but if it already goes gray, like you're screwed, laser won't cut it. But if you do it when it's black, laser, laser, and it won't come back for the most part, I'm on it.
I love it.
He'll have an
Hurry
appointment
up.
in a week or
Get
two.
in while you can.
Okay, it's good.
Get in
to
while
know.
you can.
I did not know that.
Time
Can
is
you
a ticking.
do?
I did
I
not
have
know.
a question.
Can you color your hair and then laser?
Oh,
No, because it
great
doesn't go in the hair
question.
follicle.
Good call, though.
But
Wow.
thank you for asking.
Someone online was
No,
like,
it
I was
knows.
just
it
thinking
knows
that.
the difference. Seriously,
yeah,
the
If
laser
you
does?
color your hair, it's
because
not,
it doesn't know.
change
It
the
doesn't
melanin.
know self tanner from
It's
normal
not your
melanin.
melanin. It's not the hair follicle.
Okay, okay.
And so that the laser is
That's a
looking for the
great
actual
question.
hair
I love
follicle.
I
Yeah,
love that.
and it burns the hair and it goes down in the follicle and destroys the follicle.
That's
so even if
correct.
you destroy the surface hair, that's doesn't really matter.
So you
It
can
has to
hair all
follow
you
it
want.
down.
Yeah, right.
You can shave,
Yeah. It's,
but
yeah.
you can't wax or pluck, and that's because you're removing the actual follicle.
Can you do like the neck to get like a crisp, like
Oh yeah,
Like,
we have
uh,
a lot of guys that want like a
crisp,
really defined,
like facial?
Yeah,
Oh,
and
I love
actually,
that
I will
look.
say, like,
Yeah.
I don't normally feel a lot of. I mean, there is pressure.
It's a little
Yeah.
artistic.
Yeah.
But this is like barbershop.
Yeah,
Like,
yeah, yeah.
You're like, oh, I want a line here. I want a line here.
You're
Yeah.
like painters taping it off.
Yeah, that's yes. And then like
Hey.
a distinct line on the neck,
So-
and that matters.
And
yeah.
all these men spend money weekly to go get all that done.
And all
We
you
can
have
take
to
care
do-
of it forever.
That is interesting.
And it's very affordable. I think it's one of the most affordable
hair
things we
reduction
do.
really is.
Yeah, and it's long term, and you don't have to deal with it all the time.
But I
That's the
noticed you're
thing.
saying-
It's long term.
And I noticed you're saying hair reduction.
Yeah,
and
reduction.
Not hair removal.
Yeah, yeah.
Why is that?
Well, the FDA. So they can't say we can remove it. So we
Reduce
can
it.
only say we can reduce it. And that's because typically you need a touch-up treatment.
Yeah.
So you finish your series,
you do
live,
6, right?
Yeah. So a series of 6 is average. That's totally average. And then we can actually kind of follow you through. I tell my guys, like after their back hair, I actually did, I don't know, 4 or 5 guys this summer. And they were also sent by their wives. But
They're like, I'm sick of
I'm
shaving.
sick of
Let's go
shaving,
to
yeah.
they
her.
went to the pool one day, and then their wife was like, "Nope, you got to go." But we did a series of 6, which means actually 1 treatment every 4 to 6 weeks, followed by your hair cycle, so that we can keep you on a successful path. And then after that, I say plan on a touch-up treatment every year-ish.
Okay. That's not bad.
And that's just because sometimes that follicle
Yeah.
gets frisky.
I think that's more than worth it.
Yeah.
Yeah.
So hair reduction, not hair removal.
So hair restoration. this is a huge issue for guys. Like, I know so many men in my life, even in their 20s, they're like, I think I'm losing it. I think I'm getting thin. I think I'm getting thin. What can I do? What can I do? So what do we offer for that?
Generally, it'd be a 3-step process, right? I mean, there's a prescription medication that you can give.
Multiple.
There are
Multiple.
some topicals. There's some nutritional supplements you can take,
Yep.
and then there's some injections that we can offer. So that triple modality,
Yeah.
generally, we'll see results.
Yeah, I would say, so we'll do hormonal testing to see if certain medications will work better, but there are multiple medications we use for men in particular. So there's finasteride, there's minoxidil, and so you can use both of those, oral or topical, to help with hair restoration. And they have
What do you think
great
men
results.
see? I know between men and women
Yeah,
working with hair,
yeah.
topical versus oral.
I hate topical.
Because
Because
this
it's a
is
pain. No one wants
yes.
to continue with it. So I
Makes your hair
will,
greasy.
like I will, for women, so I have very thin hair. So I tried a topical through a compounding pharmacy and I was like, what do you have to help me like put it all in there? So they just put it all in and I would like rub it every night. And my husband, Jarrad, he would be like, so spironolactone, just so we know, for women, topical, it literally smells like sulfur. So
Oh, that's the worst.
he was
smell.
like, how long are we going to be doing that?
as long as it takes.
Forever with my luscious blossom again. And like, not that our sex life is like booming, but that was not helping.
that was not doing
He
it.
was like, can you, is there anything else you can do? So I prefer to recommend oral for women and men. It just works
Don't you
better.
think, right?
100%
for men
works
too.
better. And
Yeah.
for studies, like in studies also, it just
Yeah.
works better
Yeah.
for topical oral.
So
for
is
sure.
is there like because like I feel like men either like kind of lose it here or here. Is there an area? Is it equal on like result wise from these treatments? Like in which area it is, or
For
does
the injections, it's equal.
Equal?
Pretty much. Depending on like how severe your male
Gotcha.
male
Yeah.
pattern baldness is.
Yeah.
But injections in general, compared to women, men work better
yeah.
than
Interesting.
women. 100%. Why
Which is
men that have
also
come in
unfair.
and they're like, it's just here and here, and I'm like, you should just get injections. I hate
Yeah.
you, but just get the injections because it does really work.
But you
very
can't come
well.
in bald.
Yeah.
No, yeah, you're not.
So
gonna
like it's male pattern baldness, not like alopecia. There's a difference, right?
there's a difference.
Okay, I just
100%.
okay
Yeah.
Difference. Yeah.
because I know people have all like bald spots from like alopecia.
And also, people need to realize whatever you do, you have to keep doing that for the hair to
Yeah.
continue
it's
to
not
be
a
there.
quick fix.
So if you
So I
do,
warn
so say
people.
you do the
Anything.
topical or the injection, say
anything.
anything. So oral or injections, do you do it for like a series and come back, like take a break, come back kind of thing? Okay. Because you can lose it again.
Maintenance.
You
It's
will
not a
lose-
permanent.
You will lose it.
Now, why are people losing it? Like from a functional medicine
I
standpoint?
mean, there's so many reasons.
Well, let's hear them. What are the
I mean,
reasons?
mostly it's genetic.
Okay. Is it like is it the dad on your mom's side? Everybody always said that. If the dad on your mom's side had hair issues, you're going to have hair issues. Is that a thing? Or
I think
is
that's
it all
what I
over?
learned, but I'm not sure if
Okay,
I learned
okay.
it or I just.
I've
like,
always
think
heard that. I don't
from-
know if that's
yeah.
true.
And we always check hormones.
Okay.
I would say right now with all the GLPs, we see a lot from weight
Yeah.
loss.
From GLP-1s?
ton
Does
from
that
weight
cause,
some
cause
of
hair
it is
loss?
nutritional.
But patients will say,
Oh.
they're like, oh, it's the medication. I'm like, it's not the medication. It's the fact that you lost weight. You can lose weight not eating. You will still lose the hair.
Interesting.
I don't care
'Cause,
how you
well,
lose the weight.
people with eating disorders typically have thin
You
hair.
lose
Yeah.
the hair. It's not
Yeah.
a side effect of GLPs.
Yeah.
It's a side effect of the weight loss.
Interesting. So not like that they're eating less and getting less nutrition.
No, 100%.
It's
It's that they're eating less and getting
less nutrition.
for sure.
Okay, so it's the less nutrition, not really the
Yeah.
weight loss that's causing it.
No,
it's
but
just
those
less.
go hand in
Okay,
hand.
okay.
Yeah.
I just wanted to like.
No, yeah.
Yeah. Okay.
So usually we'll recommend Nutrafol for that.
Interesting.
Just
Does
because it's
Nutrafol
nutritional.
work well? I haven't tried it yet. People really love it.
For the right people, it works.
Yeah,
well.
I have so many patients that
Yes.
we have it in our office and they buy it like all the
it-
time,
It's
love
part
it.
of the hair
stinks.
restoration
Yeah.
package.
It
So if
smells.
I just-
if
I have,
what?
fortunately,
disgusting.
I haven't had to like deal
It
with it
smells
yet.
so bad. You have 4 pills. It smells. So that tells you how much it works
well,
because patients keep
all
getting
your
it.
supplements.
I have a tackle box of supplements and they all stink.
how
Whatever.
you
We
know
don't
they
put you on them. We don't put you
how you
on
know you
them
get the good
forever.
The more they stink, the better they work.
Yeah.
We don't put you on them.
That's why
forever.
your sulfur hair shit
The
was
stuff
going to
that
work.
doesn't work
and
Beauty
smells
is
really
pain.
good.
Except I wouldn't have sex for like months.
You're divorced, but you got a lot of hair.
Stop having sex, okay? Whatever.
Hair looks great, but I lost my husband over it.
Jared would rather me be bald.
That is hilarious. Since we're laughing, I have to bring this up now because I don't want to forget to bring it up. But there's so many kind of comical, and I want to get into functional medicine, like deep dive into, because that's like health, and I want to definitely talk about that. But like, since we're kind of joking, it seems appropriate. On the aesthetic side, there is some interesting male specific treatments. And on the surgical side, there's some interesting male specific treatments that we do not do, for rightfully so. And I just would love to get, your takes on it. So we've been talking a lot to you guys. So surgically speaking, there are pec implants, calf implants. There's a surgery where you can add extensions to your leg bones to be taller. There is, what am I missing? Oh, like
Anything.
bicep implants.
Yeah.
I mean, you can do anything.
Yep.
So I know we don't do those things. So speak on that a little bit and as to the why. And it's just kind of interesting. So
Yeah, I mean, I think for any body part
Yeah.
a human being has, that can be looked at and criticized, and a patient or a person can wish that it looked different, right? So many techniques have been tried for almost every area of the body, and some of them work well and some of them don't. And I think that particularly in the bodybuilding world, there are a lot of people who wish that they had bigger muscles, right? So it's a lot of things you just mentioned are trying to make those areas look better. And for the competitors in those worlds, usually those things are not allowed. It has to be the natural physique that gives that shape. But for those who don't, they can. And we don't do it because, number one, I wasn't trained in those things. They're really specific. Number two, there's just a lot of pitfalls. It can extrude, it can move. Those are active, dynamic areas of the body, and those implants can switch positions and then look really, really strange. They can get infected, and so there's just a whole list of things that makes them difficult to manage. And so there are areas or practices that specialize in that, and surgeons who do those things. And I'm happy to refer patients on if those things interest them.
And I don't want to downplay that, because I know, like, genetically speaking, sometimes people need that because they have a deformity or something. So that's like a whole different avenue of talking about plastic surgery. This is just for things aesthetically, like you said, they just want to be bigger and they just want to have more definition. So that's just interesting to me. The height thing, though, this is because I just watched a movie on this. It was called, it came out recently with Dakota Johnson. I can't think of the name of it. But literally the guy had surgery. I don't know where he went, and he had his, like, some bone in his leg extended to be taller. And is that a real thing?
Was it short?
Yeah, I mean, I've read about it like you have.
Okay.
I don't know.
So it's not like
much about it.
Okay.
But
I didn't know if it was.
It's done. I think it has limited
Interesting.
efficacy, but I think it works.
I love it.
Yeah.
Men are very crazy. I mean, it's a male podcast. We have to talk about the height thing. It's a thing for guys. I have a theory on it. Do you want to hear my theory? Okay, I'm going to give you my theory.
Yes.
So I think guys at 5'10" and above will say, I'm 6 foot. Okay. And so you're like, oh, so you have a warped idea of what the girl in the dating app is laughing back there. So you have a warped idea of what 6 foot is. Okay. And so you're like, if anyone's 5'10", they're like, oh yeah, I'm 6 foot. 5'11". Oh yeah, I'm 6 foot. Okay, cool. Like, you have this visual idea of what 6 foot is, like, for years. And then, like, you meet tall people who are like 6 foot and above.
How tall are
I
you?
think they're 6 foot. Like, my boyfriend's maybe.
You're
6'3", and Jared's what, 6'4"?
Yeah.
5, yeah.
Yeah.
6'5".
My kid is 5'11".
6'7".
But what's so funny is,
That's
like,
gonna date this show.
it is.
Yeah,
it is.
Throw that out there.
My son is like 6'1", and like my boyfriend is like maybe 6'2". I think they're like 6'3" and 6'4".
He's 6'1".
Nick.
Really?
Yeah. And I'm like, I think they're so much
Or is he
taller.
5'10"?
No,
That's
no.
a
I've
mom.
been to
That's a
the
mom rounding up by 6
pediatrician.
inches.
I've been to the pediatrician, and I was shocked. I'm like, he's only 6'1", but I have this warped sense of reality of what 6 foot is. So anybody who's taller than 6 foot, I think they're giants. You know what I mean? It's
So your
it's a
theory
real
is that
theory.
people who are short have been skewed by all the people who
Yes. So our
round
idea
up.
of what 6 foot is
Basically.
skewed. So anyone above 6 foot, I think, is 6'4", 6'5", but they're really 6'1", 6'2". Because we've taken a couple inches off 6 foot in reality.
Well, that's how I feel about weight.
Yeah. So there you go. Isn't it Nate Bargatze?
Yeah.
We're all 20 pounds less.
I'm
The camera adds another 10.
but I'm really 135.
The funniest thing, do you guys listen to Nate Bargatze, the comedian? Nate
Yes.
Bargatze, I love him. And he was, when he's not overweight now, he was a little bit overweight for a period. And he goes, I'm a little overweight, but I just tell people I used to be 300 pounds. And they'd be like, oh, you look amazing. He goes, but I never was.
That's amazing.
I know. That was like always this thing with weight. He was like, yeah, well, I used to be 300 pounds. And they're like, oh, sick, you look great, dude. And he was like 50 pounds overweight. But that was like his thing to do.
How can we use that?
Get a compliment. Out
I
of it.
know, but it is such a true, perception and whatever's reality. But I thought that was funny with the height thing. Because I literally just watched this movie and I was like, I got to ask about this. And I never asked, but I thought that was appropriate. So we got to touch on
The things
P-shot, Scrotox, and what's
I don't
the
know
other?
anything about those things,
And then
I do not want to know
Whole
about those things.
tox.
I've got 3 wieners at my house that I have to manage, and I'm tapped out, and that's all I want. Nobody needs a pea shot.
Jillian, will you bring me the bottle of wine for
Nobody
this part of the
needs
conversation?
any of those things.
That's funny. But it is a thing. And PSA, we do not do those things. So, but they are available if you want them. Scrotox helps with the wrinkles on the, thank you.
On the
thank
ball
you.
sack.
On the ball sack.
Are you gonna do those in
And
functional
then-
medicine?
I don't think they help you function any
Thank
better.
you.
Actually,
Sure.
Dr. Donaldson.
Also, no one cares
Yeah,
about the
you
wrinkles
said
on
you
your
would do
ball
that,
sack.
right? You would do the Scrotox and P shots and the.
On patients or yourself?
Yeah. What are your thoughts?
My thoughts are that I have delegated Botox injections now for
He's
over
strictly
5
surgery.
years. So
Strictly
guys
surgery.
probably don't want me
Yeah.
injecting
Agreed.
that anywhere, and
Agreed.
particularly there.
Agree. I'll also mention that since you're saying it, the people that call in and are like, I want the surgeon to do my Botox and laser and filler. I'm like, no, you don't.
Yeah.
They're in surgery 4 days a week. You want this person, not you, this person and her counterparts that do it all day, 5 days a week, 40 hours a
It's
week.
a different level of expertise.
Yeah.
I mean, when I did it a lot, I was very good at it, and I still wasn't as good as they are now.
Yeah.
They devote their whole day, their whole week, their whole
Yes.
career to it, and it's a different mentality, and it's a whole different ballgame.
Yeah,
So I
agreed.
think our patients get much better care now that this team is dedicated to that than when I was giving half of my attention to that.
Similar to our post-op team.
Yeah.
That's all they do.
Yeah.
They take care of our surgery patients.
Yeah.
It's just like how medicine is going, right? Like
Yeah.
you have your cardiologist, you have your vascular surgeon, you have your orthopedist, you have your PCP. Like all of these people, it's annoying. It can seem annoying, right? And it can seem discombobulated, but everybody's there for a reason.
Yeah.
And we're lucky that we've had a practice that's grown pretty large at this point, and because of it's grown out of patient needs. And so, one surgeon who operates and does injectables and sees their patients preoperatively, postoperatively, every single visit can't possibly be as good at each of those things if they're not doing that one thing
Right.
day in and day out. And so I think we all have really well-defined roles, and we have very specific niche and taking care of every single patient, and they get the benefit of multiple people involved in their care
Everyone's, has their talents.
that way.
So functionally because we'll just move on from the P shots and all that.
I don't.
Do you need to
Yeah.
leave? Do you need to leave?
Don't worry.
Functionally,
take your
functional
olives.
medicine. So leading up to
Yeah,
this,
I hate
Because you ate olives.
leading up to this podcast, I literally asked all the men in my life, I'm doing a podcast about,
gonna give me all the
not
weird
I'm
questions?
doing, we are doing a podcast about men. And we're talking about surgery, we're talking about aesthetics, we're talking about functional medicine. I'm like, what as a man do you care about? Every single guy I asked said the same 3 things.
Oh,
It was
boy.
crazy.
You should have prepped me for this. Okay, what are they?
They cared
No,
about.
wait. Try to guess.
Oh, this is fun. go.
Fun game.
Let's do it. 3 things.
In terms of functional medicine, what they care about most?
Yeah,
Just
what
in
was
general.
the question you asked them?
It could be in general. It
What
kind
preface
of.
In
did you
life?
give
What-
them?
It's like, okay, if they're like, if you want to hear a podcast that's going to help you, what do you want? What do you want to learn from it? Like, what do you care about? What do you
Sexual
want?
health.
What
And it was
demographic
like-
were you asking?
All right.
I
Not my
asked
question.
20s to 50s.
So you asked your son
And they all had the same 3 answers. They all just, no, I asked more than that.
longevity.
And they all had the same 3 answers. No.
Those are my patient. Body comp.
Sexual health.
No. But that said, the older guys were on HRT already, so that could be why. So that's a caveat, but I would say that's probably a big one. Yeah.
Energy.
Energy. That was one.
And not body comp and not sexual health.
Well, look good. So body comp.
Oh, okay.
Yep.
Okay.
It was
Yeah, you're nailing
energy,
it.
focus, look good.
Focus.
Yep. Energy, focus, look
Why
good.
is
Every one
everybody
of them
on
said the same
Adderall?
thing. So really quick. So energy, focus, and looking good. So
Yeah.
body comp falls into that.
Yeah.
Take me through like just
What we would
from a
talk
functional medicine standpoint. The men you see,
Yeah.
what are their complaints?
Yeah.
What do we have to offer, and how do we fix them?
So I feel like most of the men, if we hear anything about energy, it is a stress-filled male, usually like exec or just high stress. And so when we're dealing with fatigue, we do a plethora of labs, but we also do cortisol. And cortisol is super important for males and energy, or even females and energy. And so we do cortisol testing. We can see like what their cortisol is supposed to be through the day, how it should pattern through the day, and match that with their symptoms. A lot more goes into energy than just cortisol. So we also talk about diet, we talk about exercise. We go through normal labs like your thyroid. I shouldn't say normal because I just feel like everyone should do them, but they're the labs we do. So thyroid, we do blood count, iron and vitamin D and B12. So the typical nutritional labs that we do. And then hormones, obviously. So we do testosterone, estrogen. So testosterone is a big one that can be low with energy. It can also, so men, when they first come in, they want to come in just for their testosterone. But it's not like testosterone just doesn't go low for no reason. I mean, it does go low with age, but the higher your stress goes and the higher your cortisol is, the lower testosterone will go. So you can't test testosterone without also testing cortisol. So if you have a low testosterone, but your cortisol is really high, I need to fix your cortisol first, or else I'm just putting a Band-Aid on the problem, right? So I need to fix the stress level. I need to fix just lifestyle things first. And then your testosterone actually can come up a lot naturally. Like I've had many patients double their testosterone just working on lifestyle and supplements.
Interesting.
Yeah, and I get it. Most of us just want the quick, easy fix of a shot. But at the end of I think deep down people don't really want that.
Yeah.
Like I think they want to just fix it naturally because once you're on testosterone, you're kind of on it.
Yeah.
Like once you're on it, you'll stop producing it. So you do need to be on it long term, which I have that
Interesting.
conversation. So you can't do it super young because if you ever want to have kids, you can't go on testosterone.
Interesting.
For fertility.
That's good to know.
100% you cannot go on.
Okay.
That is a contraindication. If
So
you ever wanna
young
have
people don't do it or you're going to screw yourself.
100%.
When do you think is a good age to like start?
Whenever
do
you're
it?
done having kids.
Done having
it's
kids.
on there.
Okay.
So if you have it when you still want to be fertile, if you stop it, like it can take up to 2 years. And even then
Interesting.
it's not even close to 100%.
Interesting.
Yeah.
That's really good to know. Because I feel like there's it's become this like commodity on every street corner that like people are getting it everywhere. And that's scary.
It is scary.
Because if people
do
just want to make
crazy-
money on you, they don't give a crap if you're going to have kids or want to have kids later in life. They're like,
No, they
yeah,
don't even
it's
ask.
low. Let's give it to you.
Yeah.
And it's
but
become
no,
a
it's not gonna
household
get-
topic too.
Yeah.
Yeah.
Guys constantly talking about testosterone level, which I think
Yes.
would have been a taboo topic 10
Yeah.
years ago, and now people are freely
Yeah.
discussing it.
It is hard though because there's a big gray zone as far as testosterone goes. So we know that the regulations, like if you look at the Urological Society, like their definition of low testosterone is under 250, maybe 300, 250. And then if you're treating testosterone, you really want it closer to over 600. Like, so then there's this gray zone. Well, I'm at 400.
So if you're 400, what do you do? Do you supplement?
Depends
or do
who you
not?
see. So if you see your conventional, like they're not going to give you anything. because technically
Are
you're
there
not
no
low.
like
Well,
Insurance
guidelines
are
and
not, like the
isn't it-
guidelines are under 250 or under 300.
And isn't it just a blood test?
So if you're 400, you have to hang out.
and it's
So
a-
you need two. So
Interesting.
technically, for the guidelines, you need two different testing. Like technically around 8 a.m. So it should be early in the morning, two separate
okay.
times under
'cause
250.
you're your highest in the morning, right?
Correct.
Yeah.
And then you qualify for hypogonadism. So then when you get that, I can put on your hypogonadism. I can't put it on without it because technically that would be not legal.
Interesting.
Yeah. So otherwise, you're in this gray zone.
Interesting. Is there a form of testosterone that you prefer for people, like injections, topical, or like pellets?
For men, I prefer injection.
Interesting.
Yeah, you can do topicals. You can do androgel.
Yeah.
It has great
Because
research
men
behind
don't
it.
tolerate injections.
Very true. This is a real thing.
Actually, they tolerate it much better because it's much cheaper than androgel.
Oh, that's interesting. Yeah.
Interesting.
They tolerate it better because it's cheaper. It's just cheaper.
Is the androgel like the same thing like females take for HRT testosterone or no?
No, so
Okay.
androgel is FDA approved, which maybe now that the black box warning is off for
Yeah,
HRT.
that's new.
Yeah, it's a
Interesting.
huge deal. But so for women, there's no FDA approved for women. So when we use androgel for women, we actually use a teeny amount of androgel.
Interesting.
But for men, it's FDA approved. You can use it.
Nice.
Yeah.
Since you're the only guy on the panel, I feel I'd be remiss not to bring this up.
Thank you.
Like, what do you feel like, you're what, 35? Am I close?
20.
If you're
35.
rounding down.
28,
35?
35,
28. He did his residency for 6 months.
plus 15, 50.
Okay.
Yeah.
We're like the same age. So like, I feel like from my perspective, you have handled being, now granted, you don't technically age till 65 or whatever. So, but I feel like you've handled getting older really well. Like as far as like weight, like you were just, I think you said like literally you had the same jacket you wore in college, like your sport coat or something.
True. Yeah.
But you are always, I feel like have energy. You're up early, you're active, you're doing stuff. What do you like from your standpoint do in your life that I feel like you feel good generally? Like I don't feel like you complain about ever being tired. Knock on wood. I don't ever want to say this, but you're never sick.
Yeah.
You know what I mean? Like I feel like you're just a really like a good example of getting older and handling it well. So what do you think you have done on your end to maybe it's genetics, I don't know.
Yeah,
but
I mean, I think it starts with genetics. I mean,
Yeah.
my parents have always been healthy and not had a lot of medical issues. And I think just I work hard with basic lifestyle routines every day. So I make sure I get good sleep. I make sure I'm well rested. My wife cooks really well, so we have great food in the house.
shout out Liz.
And works with
does.
Dr. Weston and the team to come up with great recipes that are healthy for us. And my whole family's gotten into that and embraced that. So my son and my daughter, same things. We all eat very well. And I exercise regularly. So I mean, I think those are foundational things. And then I think some of the things that we've learned through functional medicine, having that in our practice and having that be an important part of our focus has helped as well with supplements and with being aware of what's good and what's not. I think also when you look at just longevity and performance in general, you don't smoke, right? You don't drink or addicted to drugs in excess, right?
Right.
So things in moderation. I think just good
Let's go with
basic.
that.
Yeah. So I think those have been the things for me.
I love it. Well, you've done a great job.
Thank you.
I don't know how you do it because you do surgery so early and like you still get up and like get your workout in and I'm like exhausted thinking about it. So, let's just like still focus on testosterone because that's all I hear about. I don't care if it's my son. I don't care if it's my brothers, you name it. They're all talking about it for different reasons. Why is it such a topic? Like why are men struggling with low testosterone like nowadays? Are we more just testing for it and aware of it, or is it like lifestyle environment that's causing it?
Yeah, I mean, I think as you age, your testosterone decreases, but I do think environment plays a huge
A
role.
lot of young people have low testosterone right now.
Yeah.
Yeah.
I think a lot of it is stress.
Yeah.
Stress does play a huge role. If you were to ask me, like, if I could just subjectively say of my patients, because I see a lot of patients who are very stressed. Like,
Men and women, or are you talking about men?
I'm talking about men.
Okay.
I have a lot of men in very high roles, whether it be in like multiple different arenas. I could guarantee you pick who is going to have those. And they're buff, they're high stress, so their testosterone is low.
Is there anything, when you say buff, is there anything in the bodybuilding, like workout world that can suppress testosterone? Like, I know like they're into pre-workouts and they're into these SARMs and they're into all these things to make themselves
SARMs?
big.
Yeah,
It's like this,
androgen
like,
receptor modulators.
it's like a thing that it's like
What
not
is that?
it's not an anabolic steroid, but it makes you really big, so it goes under the radar if you're like a professional athlete.
So things that could create low testosterone in
Yeah.
that environment. So usually lifting weights, eating appropriate protein will increase your testosterone, but my endurance athletes usually have low testosterone because endurance athletes often do.
Yeah, so-
And that's the whole like hypothalamic. So the like the messages from the brain to the
Nerd
testicles.
alert. Nerd alert.
Same thing with the
Here we
brain
go.
to the ovaries.
I love it. I love
They
it.
don't
I
have,
love it.
but they,
I love
guys
it.
don't have ovaries.
They have testicles though. They're the same
Oh,
thing.
same
So
thing.
the
Well,
brain
I
to
need
the
clarification.
testicle-
I'm not a nerd.
The brain to the
I was like, wait.
testicle
They're the same
messages can be the same thing, so it will be
Wait,
suppressed.
ovaries and testicles are the same thing?
Yes.
Yeah, embryologically,
Yes.
for sure.
I did not know this.
Not
Yeah.
in adults.
Well, I know that.
Embryologically, as is
I
the
know that.
penis and the clitoris.
Yeah, I knew that. I knew that.
We had a whole
I knew that.
conversation about this.
Yeah.
Wait, the penis
And the
and
Yes,
scrotum and the
this
labia
is what-
majora.
yes, I was just
Carrie.
going to say that. I was
Yes.
like, wait,
Don't
is it
you
labia
remember?
majora? But I had no
Yes, we
idea.
remember.
Don't you
Carrie does not.
Yes, but I did not know about what you just said.
Penis and clitoris.
Well, I knew that. What did you just say? Ovaries and
and
testicles.
testicles?
Did not know that
Yeah,
they were
it's
like
just
one and
that
the same.
the testicles descend.
Yeah,
go down.
that makes total sense to me.
Ovaries stay up.
1,000,000% sense to me. I never have heard that. I'm 50, whatever.
Yeah, it's actually amazing.
You were this many years old.
I know.
when you
But
learned that.
I am
the
51 and I
hormonal
just
messaging-
learned that ovaries and testicles are one and the same.
But the hormonal messaging
One's
is
dropped,
also
one's
the
not.
same.
Interesting.
Yeah, so you get the same.
The body's
So
so
the same
interesting
thing with
to me.
like
I'm
women
not
who
kidding
don't
you.
have periods when
Yeah.
they're very active and they're endurance athletes.
That makes total sense.
They think they're
But they don't
testicles.
have.
That
but
makes
men,
total
Men
sense.
don't have they don't have the red flags that the women do.
So, like, let's talk about working out. So, I know women, you always preach, because this is our first male episode, so we always talk about women. You always preach lift heavy as you age and do less endurance training, more like, the whatever, high intensity stuff, like quick stuff. Like, so is that the same for men, or do you want them to do something different than like women do as they age, like to help with keeping weight off, longevity, those kind of things, testosterone up, whatever?
So it depends what your goals are. So if your goal is testosterone, you need to lift weights.
Okay. And lift
do
heavy.
less, and
Okay.
do less endurance, like long endurance.
Okay.
If your goal is longevity, you need to do both. Like you need to do zone 2 and zone 5. And then if your goal is weight loss, men can do things completely differently.
I
Yeah,
hate
it's
that.
so unfair.
They can literally say, I'm not going to eat and I'm whatever, and they just lose like 20
My husband
pounds.
gets
Do you
sick
wanna
and he's
know
like,
why?
I'm down
Why?
15
Yes,
pounds.
I do. I want to know why. I
it's
look at food and gain weight, and
I
he'll
know
say
we've
I
talked
want
about
to
it
lose
before,
weight
but I'm
and
gonna
lose it.
say it again. It's because women. So I did eating disorders a lot with my college athletes, and we would always talk about you need 30 calories per kilogram of body weight in order to keep your hormones working.
Okay.
So if we fast less than that amount, your hormones will jack you up, and they're like, oh, we want to keep food because we think we always need to procreate, and so your body will keep that. Men, it is half that. It is 15.
That's crap.
It's actually crap.
Well, but I thought fasting was kind of good though.
Fasting is really
like
good for,
appropriately.
It depends what your goal is.
Yeah.
So it depends what your goal is. If your goal
Detox.
is weight loss, men do a great job with fasting and weight. For women, if it's detox, you don't actually need a ton of fasting.
Isn't it like 3 days? Like
It depends what your goal is.
36 hours. Maybe it's just 36
It depends what your
hours.
goal is. So if you want more stem cells, you need at least 36 hours, sometimes more depending on your metabolic health, to start releasing stem cells. I don't think you need to do that all the time, but it depends what your goal is. If your goal is like cancer prevention,
Yeah.
yes, that could be super helpful.
Interesting.
If your goal is weight loss, it might not be the answer to your problem.
I don't want to live with my husband if he's fasting.
Yeah.
You don't want to live with him, he's fasting? Is he not nice?
No. Angry.
See, my husband, I feel like could not eat for 5 days.
Oh,
that's good for you. He'd be like, okay.
Brian,
he's
that's
just
all he
joyful all the
freaking
time.
does.
Could
is
you fast?
He fasts and that's all he does.
You're
Yeah.
a surgeon. I feel like I'm not going to.
Have you ever worn a diaper in the operating room? I've heard that's the thing.
I'm not.
Because they're in there so long, they don't want to scrub out. It's more
also
like
don't
transplant
drink,
stuff,
like-
I get, but.
Anything can
Yeah.
wait 5 minutes. While
But do you
handle your
fast?
business.
But do you fast though?
On occasion.
Yeah. My so Brian, my boyfriend, that's all he does, and he loves it, and it drives me effing crazy. I have so much energy. I have so much focus. My brain fog's gone. I feel amazing. I'm like, I've never woken up a day in my life as a female and woken up and been like, I have so much energy. I feel amazing. I just want to tackle the day. Like, I've never felt that way.
Never.
Like, why is that? No, I don't remember. Maybe as a child, but
Have you ever thought about functional medicine?
yes,
She sees
I do.
our team.
And I'm way better. Don't get me wrong. And you know what's weird is recently I have like woken up on my own, not with an alarm. I've had energy, things like that. I don't know what's changed. I don't know, but before that, I'm like, I hate you right now because I feel like it's so easy for guys.
I don't ever wake up and I'm like, "Bah."
I don't get it. I don't get it. I feel like they just are more energetic and like can lose
feel
weight
like
so
you're-
They
easily.
also have a lot less responsibility.
Yeah, they can lose weight so easily. Like,
Just saying.
are there stress hormones different though from females? Because I feel like stress affects us more than men, differently, as far as weight gain, like inflammation, things like that. How are we different in that regard? From a functional medicine standpoint, how are men different from women?
It's a really long.
Well, let's go.
You
Like seriously, like
You ready to go?
I can't tell if we're talking about medical topics or
No, now
Gender
we're just
bias
talking about
topics.
whatever.
No, I just want to know like how. So, well, one of the things that we talked about, obviously, we have testosterone and like all that, but are there certain health issues that affect men more than women,
Like health issues.
like heart disease or dementia or like
yeah.
anything that men could do
Carrie, this is like
preventatively?
this is next month's
the men
podcast.
are starting to check out.
and I am a man. Consider me a man.
Okay, we'll
Yeah.
simplify it.
Okay, we need to cater this down.
From a, what are things that a guy could do today to better his health from a functional medicine standpoint? Whether it's diet, supplements.
He just said them.
It is diet supplements. Don't eat like an idiot.
Yeah. Don't smoke. Don't drink.
Sleep.
Obviously.
Yeah, I mean, it
Sleep,
is
exercise.
like the main things are across
Are there
the
any
board.
supplements
like
that
female
can
or
help
male.
testosterone specifically?
So we use a testosterone support supplement to help. If people don't want to be on testosterone or if they are fertile.
Okay.
So you can't use testosterone. So there are other pharmaceuticals and supplements you can use for it. So multiple horny goat. Horny
goat?
That's
Hold
one of
on.
That's so
one of the
appropriate.
supplements for testosterone.
That's
Horny goat?
amazing.
Yeah.
Could we
See?
I didn't
What
make it.
I
I
asked.
didn't name it.
Horny
It's not my
goat.
nomenclature.
Okay.
do we sell this?
And we do it on full script, yeah.
And so you're like,
No, it's
You need
called,
some horny
called
goat?
testosterone support. and
Dear
it's in
Jim,
there. And Trabismus,
you need horny goat.
Trabismus is in there.
You need a horny goat, and he goes into an auction.
And he says,
There are
honey,
multiple-
it was
There are
prescribed
multiple,
by my doctor.
there are multiple other supplements in the testosterone support.
That's
So
really okay. So, and like just saying this, so
honestly, the best thing you can do for natural testosterone support, whether male or female, is eat enough protein and lift heavy weights.
Okay.
And I've seen females double their
what's
testosterone.
enough protein for men?
Depends what your goals are, but minimum I would say is 1.6 grams of protein per kilogram body weight. So you take your body weight, divide by 2.2, multiply by 1.6. That's the minimum amount of protein. If you want to gain, you can do all that and then multiply it by 2. So it'd be about a gram of protein per pound if you really want to gain weight.
So two other things I'll mention from a functional medicine standpoint that I know men deal with. That's a big deal because I hear radio ads about it daily. ED. Is there anything that from a functional standpoint they can do to help that?
Honestly, the most common reason for ED is poor vascular health.
Alcohol.
So we're talking about cholesterol, poor metabolic health. So we're talking about sugar, and then alcohol for sure. But like ED is just a red flag for other main issues going on in your health.
Is there anything they can do naturally or from a supplement standpoint to help that?
Naturally would be to fix the underlying problem, and that's also going to help you live longer.
So stop drinking alcohol as much, stop the
Like
sugar,
look at your metabolic health and
processed
look at your
food.
cholesterol health.
Okay.
Like the problem with ED is that you don't get the blood flow to the important places. So you don't get the blood flow because of cholesterol. You don't get the blood flow because your poor metabolic health, which also leads to cholesterol buildup. So it's really a red flag for other things.
That's all. The other thing that I know younger men care about is fertility. And I know we do that at our office too. Is there anything from a fertility standpoint for someone who's like trying to get pregnant that they can do to like help things?
I would say it's important to get a sperm assessment. Like whether with your urologist or with us, you can get a sperm assessment. And then if you can see like the motility of your sperm or the morphology of your sperm, and then we can have things in place to try to help you diet and lifestyle wise and supplement wise, mostly for mitochondrial health, for like the energy center of your cells, to help with that. So I would do that. I will just say, since we're wrapping up, if you are going to get testosterone treatment somewhere, make sure it's somewhere that does lab work. So you can have like high cholesterol, high liver enzymes, you can have high hemoglobin, which puts you at higher risk for heart attack and stroke. You need to go somewhere that's actually going to do lab work and not some like mail away place that you just get your testosterone and never have labs. That is dangerous.
Right.
So testosterone is not expensive. It's not hard to do, but you should be with someone who actually does the lab work.
Well, and like all the
needed.
sex hormones coincide. So if you're
100%.
doing like your progesterone, your estrogen, all is affected. So you need
So
to
that's
like
the
monitor
thing.
all
Like
that.
a lot of times, patients, if you go to like a mail away place, they'll automatically give you something called a nostrozole, which will block your estrogen. So when you're on testosterone, your body can convert testosterone to estrogen, and so that's one of the ways you can get male breasts. And so you'll have an increase. If your estrogen is higher, you'll have increased breast growth, and so a lot of places will just give you that, like, oh, you get your testosterone, you get your nostrozole, and here you go. But the problem is men are like, oh yeah, I don't want breasts, I'll decrease my estrogen. Well, that also screws your bone growth. So you want to talk about men who are going to have osteoporosis? Those are the guys who are on testosterone, automatically took a nostrozole without any lab work, and you're screwed. And you know what? You're more likely to die of a hip fracture. If you have a hip fracture, 65 or older, you're going to die 1/3 of the time within 2 years.
Interesting.
Like that is malpractice.
Yeah.
So go somewhere that's actually going to do lab work and going to see, do you actually need the nostrozole?
Yeah.
I probably have not even probably half of my men need a nostrozole when they're on testosterone. You only need it if your estrogen, there are very specific guidelines around it. You only need it if you're over a certain amount or if you have symptoms. So that like drives me crazy.
Interesting.
Because estrogen is really important for men too.
Yeah.
So
I think that's true with
That's
most.
it. That's my soapbox.
Most mail order medical places, right? I mean, GLP-1s.
Kills me.
You want to be followed. You want
Everything,
lab
yeah.
work. You want blood work.
Yes.
It has to be done.
We didn't even touch
in a
on male
responsible-
weight loss,
Right.
but GLP-1s we do as well. And that's another thing, like they're at every corner, but make sure you're being monitored.
That's
by
another
a
reason you
health-
can have low testosterone.
Yeah.
So in our fat cells, we can convert our testosterone into estrogen. So just losing weight will increase your testosterone. So I will not give testosterone if I have a male patient with a BMI of like 35. I'm not going to give him testosterone. I'm going to help him lose weight. We'll talk about testosterone once you're of the adequate weight.
Interesting.
Like otherwise, that is not good medicine.
It's a slippery slope.
It's
Yeah.
just not good. I mean, I actually think it's not good medicine. And
love
that's
that.
I get angry.
We can't tell.
Yeah.
Well, it's just
That's why we
it's
love
just
you,
not
though.
appropriate.
Well, because you do the right things. You're not out for the money grab. You're out to do what's right for patients. So that's why we love you. All right. We're wrapping up. We got dinner to go to. Do you have anything to like
good.
in closing that you want to say that we didn't discuss?
Well, it's a good time to be a man. There's more research.
Yeah.
There's more research.
I agree.
There's more medication.
No, you guys haven't had a
There's
lot of
more
research
blood
in
work.
the
There's
last 100
more
years.
procedures that are available.
Yeah.
And these things are being talked
and
about.
we
Like
have it all.
Jared came and shared
Yes.
with his
Well,
story,
that
Jared is
was
my
amazing.
favorite.
which wouldn't have happened 30 years ago. So
I
I think
love
it's,
it.
It was great
Yeah,
that he
that's
came
true.
and shared.
it's getting
Shout
easy to
out,
talk about.
shout
I love
out to
that.
Jarrad.
Yeah.
He's going to help so many guys.
Yeah.
And I told him that. I'm like, you're going to help so many people. Because every guy that comes in is like, I don't know anyone who did this. I don't want to talk about it. They're just like secretively Googling it, trying to figure out what's going on. So that is amazing that there's no gatekeeping there. And I think that's so helpful
Yeah.
for so many people. And we do all of it. So it's like, and we are the most normal, down to earth, like you've seen us, we're drinking, we're having a good time, we get it, like relatable people that we just want to help. and there's zero judgment. And I think men worry about that, ego, whatever is involved with that, but there's zero of that. So come in, investigate, learn, make your own decisions based on that. But it's a really fun place to be at our office. So come and check it out.
Thanks,
So
guys.
cheers.
Carrie?
Cheers.
Cheers.